Chapter 18, Treating Drug Dependence. The treatment of addiction. Drug dependence those who are drug dependent come from all walks of life. Many suffer from occupational, social, psychiatric, or other medical problems that make their addiction more difficult to treat. The severity of addiction varies widely. It's essential to match treatment to their needs. You must determine the severity of the addiction and the readiness of the individual to change. If they don't want to change, it's very difficult to help them change. It's valuable to intervene at the earliest possible stage of addiction with the least restrictive form of appropriate treatment. Assessing addiction severity and readiness to change. So, addiction severity. Administration of a standardized questionnaire is a common assessment. There's something called the Addiction Severity Index that focuses on 6 problem areas: medical status, employment and support, alcohol and drug use, legal status, family and social relationships, and psychiatric status. Information from ASI can be used to identify and prioritize which problem areas are most significant and require prompt attention. Prioritizing problems. There's a need for a systematic approach in prioritizing. Maslow's hierarchy of needs focuses on individuals that are motivated by unsatisfied needs, and the lower fundamental needs must be satisfied before higher needs can be. For substance abusers, primary needs are to deal with the drug-related medical or physical alterations. They can move to the second level, safety and security issues like self-care, managing their mental health, personal and public safety issues, as well as legal issues. They cannot move on to higher levels where love and belonging, self-esteem, and self-actualization can be obtained. So here is a diagram of Maslow's hierarchy of needs, which starts with, again, those physiological needs, safety needs, belonging and love needs, esteem, and self-actualization. You must satisfy those basic needs before you can satisfy your self-actualization needs. Readiness to change. Depending on the state of readiness, providers can select the best treatment plan for specific needs. One model that is widely used in ATOD programs is the trans-theoretical model. It's a behavior change model that has many stages, and people can move back and forth fluently through stages. Typically, this model is called the stages of change model. It includes the following stages. Pre-contemplation, so the individual does not want to change, they're not thinking about changing, they don't feel that they have a need to change. So in this stage, health educators try to make the issue personal. They help to educate that individual so that they will contemplate making a change, which is the next step, which is contemplation, where they're considering to make a change. So you help them to make plans so that they move into the preparation stage where they're committed to a strategy for change. You help them set concrete plans for action, which is the next stage, where they actively attempt to change. After doing this for 6 months or more, they're considered in the maintenance stage, where they have made a change and it will start to become part of their lifestyle in order to avoid a relapse. Processes of change have different ones, and really they are different across the different stages. Principles of treatment. General approaches and findings. There's a variety of treatment approaches that exist. There's behavioral therapy, medication therapy. They're most successful typically if they have combined therapies, so there's just really not one approach, but using a variety of approaches is the best treatment option. Good outcomes depend on the sufficient duration of treatment, so one-time short-term treatment is often inadequate. A minimum of 90 days is really the minimum that you want to have for any type of long-term effect. Many drop out before receiving full benefits of therapy, and relapse rates are similar to other medical conditions. Type and goals of treatment are important, so total abstinence or responsible drug use. Effective treatment allows addicts to stop abusing and returns to a drug-free existence, transforming them into employable and productive members of society. Measures of effectiveness include family functioning, employability, criminal behavior, and the medical condition. The NIDA's principle of effective treatment include addiction is a complex but treatable disease. You have changes in your brain structure and function that persist, that could lead to relapse. There's no single treatment that's appropriate for all. You really have to match the treatment to the individual. Treatment needs to be readily available. Effective treatment attends to multiple needs and not just drug use. It's associated with problems such as age, gender, culture. Remaining in treatment for an adequate time is critical for effectiveness. The duration depends on the individual's needs. Individual and/or group counseling and other behavioral therapies are the most common. Medications are an important element of treatment, especially when combined with therapy. Individual treatment and service plans must be assessed continually and modified as necessary because individuals have changing needs. Many drug-addicted people also have other mental disorders, and they need to address all of these issues, including if they need medication for those mental disorders. Medical detoxification is only the first stage of treatment. Alone, it is rarely sufficient. Treatment does not need to be voluntary to be effective. You just need some form of strong motivation. Drug use during treatment must be monitored continuously because lapses do occur, and there's a sign that they may need to adjust to better meet their needs. Treatment programs should assess patients for presence of infectious disease and provide targeted risk reduction counseling to avoid contracting or spreading any kind of infectious disease. Most treatment includes a combination of NIDA principles and other factors for appropriate treatment. For example, the age of the drug exposure and treatment initiated, brain areas most closely associated with judgment, decision-making, and self-control rapidly develop during adolescence, so these are unique needs, biological distinctions, as well as social and environmental factors between genders. The criminal justice system is involved. Abusers need treatment during and after incarceration, but this is rare. Workplace-sponsored employee assistance programs are short-term, and they provide links or referrals to resources. Retention and treatment is influenced by individuals' motivation, the degree of support, pressure from employers, and the criminal justice or related court issues systems. Treatment providers must ensure transition to continuing care after the completion of formal treatment. Comorbidity. These are conditions in which two or more illnesses occur in the same person simultaneously or sequentially. Comorbidity between drug addiction and mental illness is very common. Those diagnosed with anxiety or mood disorders are twice as likely to suffer from drug abuse or dependence. Also true for conduct disorder and antisocial personality disorders. There's a high incidence of comorbidity, and this does not mean one causes the other. Effective treatment requires accurate diagnosis of both. Being treated for substance abuse must be screened, and they must be screened for mental illness, and vice versa. Usual providers do not have a sufficient background in either to address the full range of problems. In substance abuse, they often don't have credentials to prescribe and monitor an individual. Those in the criminal justice system lack access to either. Drug addiction treatment in the U.S. Treatment is less expensive than incarceration. $4,700 for 1 year of methadone versus $24,000 for 1 year of prison. Every dollar invested in treatment returns 4 to 7 in reduced drug-related crime, theft, and criminal justice costs. Healthcare savings include savings that exceed 12 to 1. Substantial and important non-monetary savings to the individual and society. You have fewer interpersonal conflicts, improved work productivity, and reduced drug-related incidents. Historical approaches. Alcoholics Anonymous has been around since the mid-30s, and it's now a national organization. The sole requirement to join is the desire to stop drinking. It includes a 12-step program, open meetings for anyone interested in viewing, closed meetings for recovering alcoholics to share testimonials. Rehab programs grew out of Alcoholics Anonymous, and they draw in others in need. Sometimes they would open up things called dry out houses, and they're typically 1 month long, and insurances will cover approximately 28 days. But this does differ from insurance program to insurance program. General therapeutic strategies include medical detoxification. This is systematic withdrawal under the care of a physician. Motivational enhancement therapy, where it's patient-centered. Outpatient treatment programs, and they vary from place to place. And short-term residential treatment, where you have brief treatment based on a modified 12-step program. It includes 3 to 6 week hospital-based treatment, followed by extended outpatient therapy, and participation in self-help groups such as AA. This will help to prevent relapse. Long-term residential treatment includes non-hospital setting, therapeutic community, where personal accountability and responsibility is stressed, more constructive ways to interact, and they examine damaging self-concepts, belief, and destructive behaviors. Typically, this is a comprehensive service. Individual drug counseling addresses related areas of impaired functioning, so job, crime, relationships, coping strategies to abstain and maintain, and short-term behavioral goals, referrals to supplemental services. Pharmacological strategies for opioids include methadone, naloxone, clonidine, and buprenorphine. Nicotine replacement therapies such as in gums, patches, nasal sprays, inhalers, and lozenges. And alcohol, there's things called Antabuse and Camprol. And that is the end of Chapter 18.